We're going to talk about how airway symptoms present in children. Things in children that I see the most are crowded teeth, narrow arches, restricted tongue ties, underdevelopment in their jaws, setback jaws, dark circles under their eyes, anxiety, depression, hyperactivity, mouth breathing day and night, and bedwetting. When treating children, we want to expand their arches and make them larger, but we also need to find out, why do they get small to begin with? Because if we don't fix that why, then they have a high chance of going back. It's all about the tongue and where that tongue is placed. The tongue is what determines how large our upper jaw is going to be by putting that constant pressure up at the roof of the mouth. So our goal for all of our children is tongue up to the roof of the mouth, lips closed, breathing through their nose. And that's our mantra that we say all the time. And that tongue also needs to be an unrestricted tongue. That might mean that the child needs a frenum release, and we do that with the laser in our office. And so many parents are so scared to do any kind of surgery to their children, which I totally understand. But at the end of the day, if that tongue is restricted and not able to do the proper shape and pressure to the roof of the mouth, that palate is going to develop based on the size of that tongue. A lot of kids I see where their tongues are being held down and they're narrow, that tongue might look like they can stick it out really far, but they can't make a flat pancake. It only goes straight. As you can imagine, what would that look like in an arch? So when that tongue goes up, that arch is gonna also look narrow and sticked out. That's how you get more of that buck tooth appearance. So it's all about the shape of the tongue. And once that upper jaw is developed, that lower jaw will follow. But that upper jaw, if it's underdeveloped and set back, it actually holds that lower jaw back. That lower jaw gets stuck behind an underdeveloped upper jaw and it doesn't get forward the way it should. So we want that downward forward growth of that lower jaw, which won't happen with a narrow upper jaw. So at the end of the day, with my little children, the most important thing we can do is say, where is that tongue? And how can we make sure that tongue is where it needs to be, up at the roof of the mouth at all times with your lips closed, breathing through your nose. Great news is that if your child is suffering with any of these issues, they can get help quickly. With my son, with a Healthy Start myofunctional appliance, we were seeing improvements in his nightmares within just a couple of days of wearing it consistently. On my children that are older and I'm doing a fixed expander on, within a couple weeks of expansion, we're seeing these symptoms go away or significantly improve. I had one child in my chair just yesterday that the mother was amazed that his bedwetting had almost completely stopped in only 2 weeks. We can see children that are going to be susceptible to airway issues in utero. And when they're babies, we can see them mouth breathing, we can see their jaws set back. Then once they get old enough that they're compliant enough to wear an actual expander, removable or fixed, which for some kids it might be 5 and some kids it might be 8, to make more room in their mouth. There's certain things as a parent that we can do early on. We can make sure that they're nasal breathing. We can keep that nose free and clear. Introduce what I call a nasal hygiene regimen right away, where we're getting them used to the saline rinses and the irrigation, blowing their nose, making sure that their lips are closed. That's gonna make a big difference in the really, really little ones. My goal is always to treat the child as young as possible. Please follow me and watch more of my videos.